Yes, ma'am. So in 3, 2.
Good afternoon. I now call to order the meeting of the Curriculum Committee for May 18th, 2023. In accordance with Board Policy 8311, the chair of a committee at their discretion and after consultation with the staff liaison may convene an in-person committee meeting. Otherwise, all committee meetings will be held electronically. Today's meeting is being held virtually and broadcast throughout Microsoft Teams. In order to efficiently conduct this meeting, all voting items this afternoon will be done by a roll call vote. Board members will say their names before making and seconding a motion as applicable, as well as when requesting discussion on an agenda item. Ms. Cox, please call the roll to determine the presence of a quorum of the committee.
Ms. Lichter,
Present.
Ms. Pumphrey,
Present.
Ms. Booker Dwyer, Ms. Dominowski,
Here.
Ms. Hassan, all right, thank you.
Ms. Cox, please call the roll of staff members participating in today's meeting.
Dr. McComas,
Present.
Ms. Shea,
Present.
Dr. Whitstead,
Present.
Dr. Elmendorf,
Present.
Dr. Ferguson,
Present.
and we also have Ms. Schubert, sorry,
Present.
Ms. Roach,
Present.
Ms. Matucci,
Present.
Dr. Kraft,
Present.
and we also have Ms. Jabaji.
Present.
Thank you.
Thank you. Please call and note the names of all staff members participating in the meeting. So, are
That's
there
everyone.
others?
No.
Okay,
I don't
thank you.
know, but-
Committee chairs will facilitate discussion by calling off names of committee members to speak in turn. Committee members will also acknowledge they have a question by calling on the chair, then saying their name. Staff members will answer any questions posed by committee members by saying their name first, then speaking. Staff members then want to add any discussion may call on the chair to speak, then saying their name. If the chair calls for any motions, the committee member will move and say their name, and a second committee member will second and say their name. The chair will then state, may I have a roll call vote. Assistants will speak each committee member for their vote and record appropriately for the ETA. Okay, so good afternoon, everybody, and thank you for being here. We have a lot on this agenda, so I'm going to get us started. We will start with the IB contract. And if we have any questions, we have Dr. Elmendorf, Ms. Schubert, Mr. Stahl, and Ms. Roach are available to answer. So are there any board members that have questions about the IB contract?
And if I may, Ms. Lichter, I'm so sorry to interrupt you. Dr. Elmendorf, we just realized that the previous, the wrong thing was posted. So I don't know if we want to take a moment to just find out what our questions are, and then I can have Dr. Elmendorf answer any of those questions and maybe show the correct one. So we just realized that was
Yeah, I do have the correct one up if we want to share that. Yeah,
Okay,
it's a
thank you.
previous contract that's posted, unfortunately, on board docs.
All right, so Dr. Elmendorf, do you just want to do a quick summary and then we can see if there's any questions?
Yes. Let me see here. Let me actually pull up the contract sheet, which may be in board docs as well.
Thank you for your flexibility in that. That's something that
No worries.
just realized.
Trying to figure out the best way to. So the let me share the presentation that was supposed to be in Teams or in board docs with you in Teams. That's okay.
Sure.
Okay, saying I can't present. It was going great so far. I'll share my screen instead.
Dr. Elmendorf, if I could, would you click the present mode for me?
In slideshow?
Yes, please.
Oh, this is the narrated version.
Okay, so it's still showing the background slide. Can you, on your keyboard, find the Alt tab or the Alt button and press tab to find the Teams meeting and then reshare your screen, just choosing the presentation?
What are we seeing now?
Same thing, sir, unfortunately.
I
When I
think in
click
the interest
present-
of time, if we may, could we just move forward with that? Because I
Absolutely,
don't want
Dr.
to
Bokomis.
waste more time.
Sure thing.
Thank you.
Dr. Elmendorf, you have your Teams window in front of the presentation now, though.
What's so nice to see people's faces? How'd you make that happen?
This says I'm not sharing at all, so I'm not sure what's going on. I've presented in Teams probably 100 times and haven't had
Okay,
problems till today.
so if you don't mind, why don't you just go ahead and talk through us through the IB, and we will, as soon as the meeting's concluded, if you can get that to Ms. Cox, then she will email that to the committee members so that they have that.
Okay.
Learning process here. Thank you.
All right, the IB is recognized throughout the world as a comprehensive and challenging program that focuses on critical thinking and global awareness. 10 members, the member schools of the International Schools Association created the IB organization in Geneva in 1963. And today the mission of the IB is to develop knowledgeable and caring young people who create a better and more peaceful world. There are several IB programs. IB offers a service-oriented educational framework comprised of 4 programs that focus on teaching students to think critically and independently and how to inquire with care and logic. The programs include the primary years program, or PYP, that's for elementary schools, the middle years program, or MYP, which focuses on middle school students and the first 2 years of high school, and the diploma program, or DP, and career-related program, or CP, which focus on high school students in their junior and senior years. The IB programs enable students to direct their learning and develop the skills and confidence they need to thrive and make a lasting difference in a global society. I'm going to share with you that there are 7 BCPS IB schools, and they are BCPS magnet programs, and they are accessed through the BCPS magnet application process and are highly desired instructional programs. For example, in fall of 2022, Wellwood International had 356 applicants for 24 seats. Woodmore, Middle River Middle, Stemmers Run Middle, Windsor Mill Middle, Kenwood High, and Newtown are also IB schools. We're honored to share that as of the school year 2021, all 7 BCPS schools are authorized IB World Schools. The highly rigorous process for IB World School accreditation proves that a school has achieved the IBO high standard in education and is always trying to uphold this standard. All IB schools, including the 7 BCPS IB schools, maintain program development plans at all times to set and work toward meeting strategic goals unique to their school community. Our 7 BCPS schools are deep in the process of preparing for IB program evaluation. Through the existing IB programs and the incredible work of our 7 IB schools, BCPS is proud to share that 6,584 students are currently enrolled in an IB program across the 7 schools. I see this PowerPoint is up on, I'm on slide 9. In school year 21-22, 4 students at Kenwood High School graduated with an IB diploma. In school year 21-22 marked the first graduating IB class from Newtown High School. In school year 21-22, 365 IB exams were administered across both IB high schools. Teachers and administrators at all IB schools participated in formal IB professional development. And in June, BCPS is hosting the 3rd in-district IB professional development event, offering 4 formal IB workshops open to all BCPS IB schools. I'm on the last slide now, slide 10, which is related to the contract. So in order to continue the IB programs in BCPS, it is time to bring forth a new contract. The new contract will ensure access to all necessary resources and supports from the International Baccalaureate Organization, provide means to pay annual fees for all IB schools, and exam and core program fees for high school IB programs, facilitate program evaluation by the IB every 5 years to maintain authorization as IB World Schools, allow for ongoing professional development to maintain programs required and optional, and support teachers and administrators, and ensure support from the IB organization to BCPS leadership and the 7 IB schools. With approval of this contract with $1.8 million in projected spending over 5 years, BCPS will coordinate with the IB organization and school-based staff to facilitate teacher and administrator professional development to support PYP, MYP, DP, and CP programs that I described earlier. We will also collaborate with coordinators to identify unique school-based professional development needs and plan and implement professional development and IB assessments. And lastly, we will support coordinators to successfully navigate the formal IB evaluation process. Thank you very much for your patience with the PowerPoint or lack thereof.
Thank you. Are there any questions about the information Dr. Almendorf presented? So I have a question. The last thing you said was what did you say? Assess the evaluation or?
Yeah, we'll use the contract to support the coordinators who are in the schools, the IB schools, to successfully navigate the formal IB evaluation process, which I mentioned earlier, which is going to be happening this coming school year in many cases.
Okay, for the elementary programs too? For the
Correct.
primary program?
That's correct.
Okay, thank you. No questions? May I have a motion to pass IB contract with
To
JBOs?
top it all off, my light went off.
I'm sorry, what?
To top it all off, my light went off. I had to
Oh.
motion detector back on.
That's okay. As a person who sits in the board meeting cringing every time something doesn't work, I feel everybody's pain in a different way now, so no worries. So can we have a motion to pass the IB contract as presented?
So moved. Dominowski, or do we have, do you need me to do that?
Thank you. That's fine. So, right, because I don't think Ms. Cox recognizes everybody's voice yet. So thank you, Ms. Dominowski. Is there a second?
Second, Pumphrey.
Thank you. May I have a roll call vote, please?
Ms. Lichter,
Yes.
Ms. Pumphrey,
Yes.
Ms. Dominowski.
Yes.
Thank you.
Thank you. So the IB contract can move on to the Buildings and Contracts Committee. And just a reminder that we need to send the information to Ms. Harvey as chair of Buildings and Contracts.
Yes, ma'am. I have that on my calendar as an action item for first thing tomorrow morning.
Okay, thank you. I just wanted to remember to remind. All right, next we will have a summary and then discuss and answer any questions on the Student Growth and Achievement Assessment Contract, and that is Mr. Connolly. Mr. Connolly, you still there?
Yep, I'm here. Sorry, I had a little dropout.
That's
Good
okay.
afternoon. How's everybody today?
You're good, thank you.
Okay, thank you. So our first contract here, Student Growth Achievement and Contract that I'll be talking about today. It's DEI 60623. Next slide, please. We're looking at the Student Growth and Achievement Contract as a direct focus for the Learning Accountability Results section of our strategic plan. Whatever is going on with Doug, I think it became contagious because I just lost my mouse and keyboard, but that's okay.
That's fine, Mr. Connolly, because this one was sent to us ahead of time, so.
Yeah. Oh, great.
Yeah,
So you
so-
don't need me to go through word by word. Okay,
Yeah.
next slide, please. Okay, so what is really this contract all about? The Student Growth and Achievement focuses in on our MAP testing. And our MAP testing is testing that we give to students in the fall, winter, and spring. It involves students in grades kindergarten through grade 8, and some students take different assessments at different windows of time based on their grade level and how it overlaps with state testing. MAP testing is computer-based. It's an adaptive test. So based on how students respond, the test adjusts itself to find that perfect space of half the questions right, half the questions wrong. It takes about approximately 45 to 60 minutes for a student to complete the assessment. And then families, parents, care providers, and students receive individual student reports following the assessment window closing, so they can monitor progress not only how students did on that current assessment, but in comparison to MAP assessments over time. That really is one of the great values that we have for MAP, that with all the other changes that happen with assessment at the state level, MAP has been consistent for us for many, many years, so we're able to look at progress and growth over time. Next slide, please. So what's going on with this contract? Well, the current contract expires on 9/30/23. We had gone into, for this contract, a cooperative contract, which means that there's a government contract already in place with this vendor. The agreement in place gives us the benefit of pricing. We've already gone through the RFP, so all of those pieces were done with the prior contract. But by having a cooperative, we're having a larger network of folks that are investing in the product, so that way the price then comes down. So it's really due to the scope and magnitude of a cooperative contract that it lowers the cost. So what we have, following that contract, is a series of the 10-month term of the contract catches us up to the cooperative contract dates, like they cycle. So let's say it's July to June, July to June. Our current contract expires in September, so this 10-month then brings us back into an end date of August 16th of 2024, which then is aligned with the cooperative contract. The additional option for 4 one-year extensions allow us to continue that reduced cost by matching what the contract looks like for the cooperative contract. And we have an anticipated annual cost of approximately $845,000 with a per pupil discount cost of $11.50. So basically, if we were looking at this contract separate, we would be spending an additional $220,000 annually. So again, the cooperative contract and the way that the contract is done with extensions, allows us to have that discounted pricing. So next slide, please. Great, so here's our process for moving forward with our review and approval dates. And we just wanted to see you at this time. Did you have any questions or comments that you have related to the student growth and achievement contract?
Board members, any questions about this contract? Okay, hearing none, do I have a motion to pass the student growth and achievement assessment contract?
So moved, Pumphrey.
Thank you. A second, please.
Second, Dominowski.
Thank you. May I have a roll call vote, please, Ms. Cox?
Ms. Lichter,
Yes.
Ms. Pumphrey,
Yes.
Ms. Dominowski.
Sorry, yes.
Thank you.
Thank you. We're now discuss and answer any questions on the clinical staff health service contract. And Dr. Ferguson and Ms. Matucci are available to respond to any questions.
Hi,
So,
Kim, are you?
hello.
Hi, I'm Nancy Matucci, coordinator, and I am going to go through these slides with you. Kim, is that correct?
Right, so
Or
they
we're-
received the slides ahead of time. So basically, if they have any questions, you can provide a quick overview. What is this about? What are we
Okay.
trying to accomplish? And then if there are any questions.
Okay, so you can go to the next slide. This contract is going to be bringing to, I'm so sorry, I'm doing this for Debbie. I'm a little nervous, so I'll just.
Don't be nervous. It's
I'm a little nervous.
It's
First time I had to
fine.
do this for you.
No, just relax. It's okay.
It's just people. It's just us, and we saw it ahead.
You saw it ahead. So this is our contract with the health department. We collaborate with them to provide our school health program. And this is going to be bringing together some of the grant funding that is needed to provide services. So for example, as you can see on the slide, our vision and hearing screening, our dental sealants program, our immunization compliance and communicable disease, as well as our leadership with our school-based health centers, which we have 13 in our schools, currently having 13 of our schools. Next slide. So these are the components of the contract. The grant would be covering just over $250,000 to cover the two nurse practitioners that work in 5 to 6 school-based health centers and 2 3-month preventative medicine residents that also work in our wellness centers. And then from the operating budget, it's just under $150,000 to support our school nursing program for our screening programs that we do through the health department, our dental sealant programs that they come in and do, and the support for medications for head lice for families that can't afford it. And then there's $118,500 to support the nurse practitioner who works in an additional 2 to 3 health centers. Next slide. So in general, like I said, it's a jointly implemented program that, according to law, the health department and the school system work together, collaborate to provide services for our students. The annual joint program planning evaluates the data on screening, participation, and results that is required by law, the school-based health center services, and student needs to identify location and nature of services. And the Baltimore County Department of Health does provide a detailed budget that reflects the needs and joint priorities of our program for BCPS for approval. Any questions?
Board members, do you have any questions? Okay, then may I have a motion to?
I have
Oops,
questions.
Go ahead.
Sorry.
Go ahead.
I can't tell
That's
if
okay.
you can see me or not, if I'm raising my hand. Yeah, so are all these procedures, the sealants, dental sealants, vaccines, screenings, are all these taking place inside the health school build? Like, are they, I think you said there's 13 schools that have these health facilities available. Are they, so they're taking place in the school?
Well, the screening programs take place in all our schools. So all our schools get hearing and vision screening according to what the Maryland legislation states. But we have school-based wellness centers in 13 of our schools, servicing 13 of our schools. So they are, they have a nurse practitioner that provides primary care. So if a student is sick or needs a physical, they provide that care in the school-based wellness centers. And we have Karen Jabaji here as well. She runs our school-based wellness center, so she's available to answer any other questions that might be more detailed in nature.
Okay, yeah, it's just, I guess I've never seen one of these wellness centers where they do, you know, physical screenings. I mean, not screenings, but sealants, dental sealants. And I'm just curious as how that's, where are those schools and what does that setup look like?
Okay, first, 1 second. The dental sealants is also a program that is not through the wellness center. That is a program that is throughout the county in certain schools that are identified as in need of those services. So there's not enough resources to provide it to every school, but we work with health department to identify the schools that get dental sealants programs. And Karen Jabaji, can you talk about our school-based wellness centers?
Sure. We have, as Nancy said, we have 13 school-based wellness centers. There are 3 in elementary schools, 3 in middle schools, 7 in high schools, and it's a joint effort between Baltimore County Department of Health and Baltimore County Public Schools. And it's essentially Baltimore Health Department clinics located within the health suite. So it's an extension of the health suite so that we can provide additional services for children that have barriers to getting care. And as Nancy said, we can do sports physicals, child physicals. We do some mental health screenings, immunizations, acute care, some point of care testing.
And this is just for the students that are in those schools, or can other Baltimore County students from other schools that don't have that wellness center in their school go?
Sure. So for the most part, the wellness centers are for the students that are enrolled in that school. Several of our schools, just because of proximity, do extend to neighboring schools. For example, our site at Hollibird, we can see students from Norwood Elementary, which is right across the street. And we have a similar relationship between Deep Creek Middle Clinic and Sandalwood, which is right next door. And then Dundalk Middle School has the benefit to those students can go to either the Wellness Center at Dundalk High School or Dundalk Elementary. So it depends on proximity and ease of getting the students to and from the wellness centers. But in general, our structure of our program is for the students of that building.
Is this what part of the blueprint as far as making more schools like this with more wellness centers so that all Baltimore County schools are able to give these services to their students?
Well, I mean, we really try to, we're trying to do updated needs assessments to go where students are having the most barriers to care. Our goal and timeline is not necessarily to be in all the schools, but really target our efforts in our clinics. It does take a lot of planning, logistics, building space. We are under Maryland Department of Health with as far as regulations for school-based health centers to get built out in there.
Thank you. Thank you, Karen. So Kim Ferguson, Ms. Dominowski, as far as your question around the blueprint, yes, so that is a yes. And there are other things that are happening along with that. So in our community schools, Deb Somerville has been working with Michelle Stansberry to identify the needs of the schools that have been identified as community schools. But as Ms. Jabaji said, the Maryland Department of Health really is the vehicle in front of expanding health centers. We can have the dollars, but they have to approve the actual the development or the opening of new health centers. And right now, that's kind of what's in front of us. So right now, we're still at that 13 number, but we are working with our department, our Office of Title I, to identify the needs through community schools to see whether or not we need to open up or expand our school-based wellness centers. But there is a lot of work to get to opening a center, and that includes the approval of the Maryland Department of Health, which right now we don't have. So we're still working through that process, but the blueprint definitely plays a factor into the expansion of school-based wellness centers.
Okay. Thank you so much.
Ms. Pumphrey, do you have any questions?
No, I'm good.
Okay. So at this time, may I have a motion to approve the clinical staff health service contract?
So moved, Dominowski.
Thank you. May I have a second?
Second Pumphrey.
Okay, thank you. Roll call vote, please.
Ms. Lichter,
Yes.
Ms. Pumphrey,
Yes.
Ms. Dominowski.
Yes.
Thank you.
Okay, so that contract passes or moves forward to buildings and contracts. Our next one, so don't go anywhere, Ms. Matucci. I know you like presenting here because you have the next one, the electronic health record contract.
Much more comfortable with this one.
Okay.
So the next contract is we're asking for an extension of a current contract that we have in place. So in 2019, we had a contract put in place for an electronic health record, and we use this to document all of student care. So immunization screenings, any type of screenings done by the health department, the day-to-day care that nurses provide to students as far as their visits to the health suite, illnesses, injuries, in medication administration, treatments, diabetic care is all documented in there. This contract is due to expire in March of 2024, which is in the middle of the school year. And we're requesting that we extend the contract through August so we can get it through the end of the school year and also through summer school. We just feel that ending a contract mid-year would be pretty disruptive to the school system and to the health suites and the students.
But these contracts would just go to the end of 2024 till June 30th, 2024, or?
No,
You said
the
it was
current,
good.
the
Current
current
one ends
contract,
in March, right?
yeah, it ends
sorry,
in
go ahead.
March of 2024. So we're requesting to extend it through August of 2024. So when we have next slide, please. I think the next slide talks about the RFP. Yeah. We have an RFP out because the contract is expiring, so that's in the process. A bid went out and committees are put in place. We're starting that process. So if we indeed switch vendors and we need to change to a whole new platform, we're going to need that time to have a safer, smoother transition.
Okay, thank you. Are there any questions, Ms. Pumphrey or Ms. Dominowski, about this contract?
Yes.
Go ahead.
I think mine was, it was more about the safety and security of this information. If we did have to change it, how is, I mean, I'm just kind of scared about all medical information on our students. How is that stored and taken care of, and who has access to it?
Only the school nurses have access to this, to the electronic health record, the nurses and the health assistants that work with the students. So teachers cannot access this, this platform. We've been using it, for the last few years, and it's gone through and passed all the requirements for safety and security and for confidentiality.
So do the parents of the children have access to these records, to their own child's records, I should say?
Not at this time. So there is a parent portal that we were hoping to implement pre-COVID. It was the year that COVID hit, so that kind of everything got pushed back. But our goal is to eventually implement that parent portal, so that would ease, parents could look in and see things that have happened with their children. They could sign forms, discretionary med forms. They could submit physicals via the portal. So that is the goal eventually. And it is, it's currently a part of the current vendor that we're using. But like I said, this one's ending in March. So we are looking to see, we had to put the bid out, and we are going to be reviewing other electronic health records. We just don't know where that's going to go at this point.
There would, the parents don't have access to what's in there, but there wouldn't be, you wouldn't put something in there that the parent wouldn't already know about. Like if something had happened at school, or there was any kind of medical check, whatever's being put in here about their child, they're being made aware of before it's being put in.
Well, this is just taking place of the paper health record. So before we had a folder and we would document health suite visits. So sometimes, yes, we call parents with health suite visits, depending on the nature of the injury. That's up to nursing judgment. We do not call parents with every single visit that a student makes to the health suite. That would kind of be impossible, but they certainly know that their children are getting medications or treatments, because they would have had to provide orders from their doctor and signed permission for that to happen in school. And parents, it's part of the student's cumulative record. So if a parent wants to see something, they can certainly request that from the principal and we would provide it. It's just part of the student record.
Great, thank you.
You're welcome.
Any other questions, Ms. Pumphrey? Okay, so we will now take a motion to approve the electronic health record and software package for pre-K to 12 contract.
So moved, Pumphrey.
May I have a second?
Second, Dominowski.
Thank you. A roll call vote, please, Ms. Cox.
Ms. Lichter,
Yes.
Ms. Pumphrey,
Yes.
Ms. Dominowski.
Yes.
Thank you.
Thank you. Thank you, Ms. Matucci. Our next
you.
one is the College Board Assessments and Supports. And we have Dr. Wisted and Mr. Connolly ready to answer any questions.
Good afternoon.
Good afternoon. Are there any quick summary points you want to make, Mr. Connolly?
Yes, if we could just fast forward, overly move my screen over. Next slide, please. Next one, please. Thank you, Jim. Part of the Blueprint for Maryland's Future, which you've heard about from funding sources, is to provide students with access to a variety of college and career pathways. So there's 3 different pathways that Maryland has stood up. The first pathway deals with more rigorous coursework. So there's IB programs, there's diploma programs through Cambridge, and then comparable programs that consist of AP classes, as well as looking at our next pathway, which deals with early college and dual enrollment. And then the third pathway, which looks at career and technical education programs. So the state of Maryland, as part of the Blueprint for Maryland's Future, has emphasized the importance of providing students not only with a diploma within that 4-year graduation rate, but also including opportunities for them to have college and career-ready experiences. So this contract really is one way for Baltimore County to provide students with a variety of different college and career readiness coursework, learning opportunities, as well as assessment to help prepare them as they move forward through school. So next slide, please. And sorry, next slide after that, Jim. Thank you. So I just want to show you the impact. This contract for PSAT involved over 19,000 students, which we look at their mean scores for evidence-based reading and writing, for math, as well as their benchmark, where they are in 9th grade, 10th grade, 11th grade in comparison to where the college and career readiness standards are. And that can also be used to compare to SAT. Our SAT spring day was almost 6,000 students. And then last year for the 21-22 school year, yes, last year, we had 10,300 BCPS students participate in AP courses, taking over 15,000 AP exams. So those are the highlights that I just wanted to share with you this afternoon.
Okay, thank you. Questions from board members?
Yes.
Go ahead.
I have a question about the AP testing. Looking at the slides previously, it looks like students were provided free testing for 1 AP exam this year. Is that correct?
Yes, that's what happened this past year, but for next year, it will be every examination. And actually, the board voted as part of the budget process for that to move forward, and the county executive has also moved that forward. I know we're still waiting on the final voting from the county council, but
yes. So my question is, and this sort of comes from personal experience. It seems that for the PSAT testing and the SAT testing, students are automatically enrolled and it's paid for automatically. How does that work for AP testing? Do parents, my understanding is that parents still have to sign the students up for the test. When they go to sign up, is it automatically paid for, or how does that work?
So it will be done differently next school year than it has. That is how it happened this past year. And then we covered the cost when we got the bill. We used a software program called AP, I forget the name of it, AP Advanced or something. So we won't be needing that because it will all be signed through, and the kids would still need to register, but the cost comes directly from Baltimore County. So okay. Unlike PSAT and SAT, where we're assuming everyone is taking the exam, it will be different because children have to sign up for their individual exam. That they still, we're not assuming every child who's in every course is taking every exam.
Okay.
Okay.
And is there a deadline to sign up by a certain date? I know for AP testing, and it's maybe specific to schools, it was sort of early in the year. So I think sometimes you're not, especially when you had to pay for it, you weren't sure if it was worth signing up if you're not sure if your student is going to excel in the class itself.
Unfortunately, that was the College Board that made that change the registration date a few years ago. That, Baltimore County has no control over the registration date.
So that's the same. That doesn't have anything to do with the paying for the test itself.
Correct. Mm-hmm. Yes.
Okay. Thank you.
Mr. Manowski, do you have any questions about the College Board contract?
No, thank
College
you.
Board assessment. Okay. May I have a motion to approve the College Board assessment and support contract?
So moved, Dominowski.
So
We
moved.
should have coordinated this. Okay.
Let's just alternate.
I know, there's only two of you, so somebody's got to go first, someone's got to go second. Okay, Ms. Cox, a roll call vote, please.
Ms. Lichter,
Yes.
Ms. Pumphrey,
Yes.
Ms. Dominowski.
Yes.
Thank you.
Okay, thank you. And moving on, we now have the annual magnet update. We have Dr. Elmendorf, Ms. Schubert, and Mr. Stahl available to answer any questions we have about the annual magnet update.
Thank you, Ms. Lichter. I know that the board did get a narrated version of this PowerPoint. Ms. Schubert, who is our Director of Educational Opportunities, is going to share a brief overview of this presentation for you, though.
Okay,
I'm
thank you.
excited to get to talk about magnet programs twice this afternoon. And I did want to note that Mr. Stoll is unavailable, so Ms. Roach is here to also answer questions. So in the PowerPoint that we shared with you ahead of time, we shared with you the BCPS definition of our magnet programs. We also provided and identified that we have 32 magnet locations or schools with 116 magnet programs across our elementary, middle, and high schools. We talked about the eligibility for a student to apply to our magnet programs. And we also shared the timeline that is fairly stable year to year. We gave you the dates for this past school year 22-23, in which students were applying for magnet seats in school year 23-24. We reviewed the admission process for the elementary, middle, and high school levels. And then we shared demographic data for our magnet enrollment over the last 3 years at the elementary, middle school, and high school level. And those data were disaggregated by race, by gender, by FARMS population, special ed population, and our English language learners. So at this time, do you have any questions?
Ms. Pumphrey or Ms. Dominowski, do you have any questions about the magnet program overview?
Yes, I have a question. My question is regarding I think it's slide 16 that shows the graphs. See if I can find it. Yeah, so it shows a graph of the diversity distribution for BCPS schools and magnet programs. My question is for that graph, magnet programs, so that's across all magnet programs throughout every magnet school, not specific by school, correct?
That is for all magnet programs, correct?
Okay, so because there's several magnet programs in each of those schools typically, and each school has different magnet programs. Could you, and this isn't something I need immediately, but could you send me something that shows a distribution for the schools, specifically, or schools and not just magnet programs? So all magnet schools, not. I don't know if I'm
you're clicking
that clearly.
Is she clicking in and out for other people?
So
yes.
Okay, Ms. Pumphrey, can you start again what your request is? Are you looking for a breakdown of where the magnet programs are in the schools?
I'm looking for a breakdown of the diversity in the magnet schools in general instead of all the programs together, because
is your request by school?
This represents by school would be helpful, or even if you put all the, yes, I think by school is what I'm requesting, yes.
Okay, thank you. We can work on pulling that together. We sure can.
Thank you.
Do you have any other questions, Ms. Pumphrey?
I don't think so.
Ms. Dominowski, do you have any questions about the magnet update?
No, not right. No.
Okay. All right, then may I have a motion to, oh no, we don't need a motion for this one.
No,
right?
This is just our annual, by policy, we're
update.
required annually to provide an update to the board. And so for those of you who are in curriculum committee next year, around this time, you'll see another update. And of course, anything that comes up along the way, we will also bring forward. But thank you.
Yes, I'm sorry about that. I just was on automatic motions here. So we have passed the 6 that are contracts. We've gotten the update, and then The last piece is the Dibbles and Open Court presentation, which was a much lengthier PowerPoint for us. So did you want to start that, Dr. McComas?
Yes, so thank you for the opportunity to bring back opportunity to discuss Dibbles. I know we began to have this discussion, I think in February, if I recall, it may have been March, when we were first talking about the science of reading, and we talked about our foundational literacy curriculum with Open Court. And of course, thank you all for passing our new elementary curriculum. So we have the comprehension and writing piece to go along with our foundational literacy piece. So we at that time in the earlier committee discussion had indicated that we wanted to bring this back. We wanted to have some more time to unpack Dibbles and Open Court. And so at that, I'll turn it over to Ms. Shea and Dr. Kraft.
Thank you. So Dr. Kraft and I are laughing because this is our abbreviated version, and Ms. Lichter talked about how long it was. And we really tried to, but we wanted to continue the conversation about foundational skills and the Ready to Read Act. We also would like today, of course, we want to first open it to any questions you had about the information we've already shared. But then echoing, of course, Dr. McComas's gratitude, we're of course very excited about the decision. And actually the decision with HMH into reading provides us a new opportunity related to foundational skills that we wanted to talk about today. With your permission, but to add, because I know it wasn't a part of the PowerPoint, because of course we posted this prior to the contract. So certainly want to open any questions that you have for us about the information we shared, but we would love to request the opportunity to share a new opportunity that comes based on the contract approval that's related to this same topic about the Ready to Read Act and the universal screener.
Okay, so Ms. Shea put in her T's for us. I don't know. So of course we're going to let you do that piece, but Ms. Pumphrey or Ms. Dominowski, do you have any questions related to the PowerPoint information?
No, I'd like to hear what she has to say that goes with the new curriculum.
Okay, Ms. Pumphrey, any questions before we get started on the new piece?
No, and I'm afraid I'm going to break up. So if I find any, I will email.
Okay, no worries. All right, Ms. Shea, do you want to talk about the new part?
I would love to. So HMH, as part of our contract, so I don't need any additional money. It's built into the contract. We actually have the opportunity to use a new universal screener called Amira that is built into the HMH product. I believe Mr. Corns is going to bring up our briefest version of the next PowerPoint so that you'll have this information, and we'll certainly share it with you after. You can go ahead to the next slide. So Amira is actually a universal screener. It's based on, even though it's a part of the HMH curriculum, it's actually based on a significant body of reading research from researchers like Carnegie Mellon University and Johns Hopkins, as well as University of Texas. There's over 100 published research, and it actually earned a gold standard, but it's built into the HMH curriculum. So I wanted to make that distinction because while it's built into the HMH curriculum, and so we have an opportunity to use it, it actually as a standalone has been significantly researched. And this would essentially replace Dibbles in that, but it's a Dibbles Plus in that you can see in the blue circles, this is where it would serve as a universal screener. So it listens to children read. It can detect those oral reading fluency skills using that same rapid automatic naming, which is a critical approach to screening for dyslexia and other potential for reading failure, and provides assessment reports, which we'll share with you. But the part that we're super excited about, that's the sort of Dibbles Plus, is that it actually then provides practice for children. It provides individual customized tutoring for students based on what happened in the assessment, which is something that teachers used to have to do on their own. So you can go to the next slide.
And I'm going to invite Dr. Kraft is going to be able to talk a little bit, but the first thing I wanted to establish is you saw in the presentation that we've shared actually a couple of times that the Ready to Read Act requires universal screening. In Baltimore County, we actually go beyond the requirements of the law because we do universal screening up through grade 2, and actually next year we're expanding into grade 3. And then, of course, for any student not meeting benchmark. But there are criteria based on that Ready to Read Act for what's important to have in a universal screener. And Amira's screener meets all of that criteria. And so it has multiple versions. It's quick, much quicker to administer, which we think is going to be a significant value add for teachers. It also, because it's powered by AI, so this is where we're using AI for good instead of evil. It is because it is powered by AI, it has a much stronger inter-rater reliability. So currently the Dibbles reading screener, while we shared a lot of data, you could see some highlights in our data. You can see some areas of concern in the data. One thing that has often happened is then when our team would go out and meet with the schools and actually look at the Dibbles materials, we would sometimes find errors, human errors, or we would sometimes find inconsistencies because it relies on teachers in a fluency or a timed environment noting whether or not a student effectively made a sound or produced a rhyme or was able to isolate or segment sounds. What Amira does is there's a lot more consistency, and they've tested the reliability and validity of using this AI technology for that consistent protocol, which we think is a significant add in addition to the time saver for teachers. You can go to the next slide. I mentioned already about this idea of rapid automatized naming. This is a critical skill that can be a flag for students who could potentially have a reading difficulty, including dyslexia. It's been found over time to be a reliable indicator of the brain functioning associated with reading that can give us early identification. So for many, many years, we heard stories of children who were not identified until after demonstrating reading struggle for a significant number of years. So part of the Ready to Read Act legislation is designed to have that early screening. It also helps to narrow the specific area within phonemic awareness that students are demonstrating that challenge. If you go to the next slide, I'll invite Dr. Kraft can kind of chime in and talk a little bit more about how Amira works, because she's had a little more experience with seeing a demo of the product and can speak more knowledgeably about that.
And so, like Ms. Shea said, this is a really exciting opportunity because what it does is it frees up a lot of hours, and we'll actually break down those hours for you in a few minutes for the teacher so that the teacher can be providing more individualized instruction. But Amira not only assesses the student, so they listen to the reading, they generate the running record for the teacher, but then they create this personalized pathway for students based on the reading rope. And I know we've spent a lot of time with you on the reading rope. And so there's this beautiful connection where they have what they call micro interventions, but every micro intervention is actually aligned to that reading rope that we've talked a lot about with you all. And so what that allows is to maximize instructional time. Now, when I first heard about this, I was like, but I really need to hear my students read. And I was thinking back to when I was a reading teacher. And what it does is it allows for the teacher to go back and listen to those recordings. So while the computer program can do all of the things, as the teacher, I still have access to all of that data. I can still listen to my students read. I can listen to prosody and the different parts that we know make up fluency. And so that is a nice benefit that it's a both and. You're going to benefit from the AI, and the teacher can still go in as the master practitioner and listen to their students read. Next slide. And so once the student has an opportunity to have the assessment, and just as a side note, it does assess in English and Spanish. So I know we've talked a lot about language and development, and is this a language issue? Is this a literacy issue? So that's just a side note that it does assess also in Spanish. It then provides this very actionable insight and provides reports at multiple levels. And so it gives a report that would be good for parents. It gives a report that is good for teachers. And there's also administrative level reports that they can look across teachers or grade levels or a grade band. And so that provides data that can be used at point of need to then make some instructional decisions about what students need. And so as they continue to work in the program, that data accumulates. So it's not just that one assessment point, but every interaction that they have, they are able to use that. Also, I know that Ms. Shea talked about it being gold standard, but also I just wanted to mention it does have an ESSA rating of strong. Next slide. And so this is what a parent report looks like. And so it will actually show the trajectory across time, how the student is doing, as well as providing some suggestions in a very easy to read. So it doesn't make things complicated, actually makes things really simple. Here's a few things that you could do at home to support reading. And so teachers can either share this report via email, or they can print it out and send it home, or use it in parent-teacher conferences. But it's a way to keep parents looped into how their student is doing, even more so than just those 3 times a year that we assess. Next slide.
So the next couple, I was just going to say, just in
Yeah.
the interest of time, and of course, we'll share this with all of you. We know a lot of times we're asking about, well, what kind of results did we see across other states? And so we've shared several different published research studies showing the changes in reading that happen in other districts that use this tool to help students with that foundational skills. And part of the reason that we wanted to bring this in particular today, like I said, we did not initially believe that this was going to be a part of our purchase because of the funding. And so once we were able to do it, I know I was thinking, Ms. Pumphrey, about a lot of your questions and some of your hesitation about wanting to make sure that while we are investing in that, the other components of ELA, that we don't take our foot off the gas in foundational skills and how critically important. And so we agree, and we talked to you about how, we're not at all taking our foot off the gas around open quarter letters training, but this is just another piece built into that shift into reading that we believe will strengthen that. And what's really powerful about it is the integration. And so the next couple of slides, Mr. Corns, you can flip through. We also have some evidence from other districts. So you saw Pittsburgh. Here's some New York City gains regarding fluency, which was one of those foundational components. And this is specific to multilingual learners in Texas to see the impact that it had on their fluency, and that's words correct per minute. You can go ahead to the next slide. This is just feedback from some students and some from parents and some an elementary principal and of course a teacher. You can go ahead to the next slide, and we'll of course share this all with you. We were really interested in that consistency. So that screening tool is critically important to make sure that we're identifying students at risk for reading failure early and often. So it relies on, we rely heavily on that data to help us use instruction responsibly. And we had been talking for some time about some of those challenges, as well as the instructional time. Many of our teachers shared with us DIBELS is administered face-to-face, and while each measure is brief, we do it 3 times a year at least. And I say at least because students that are receiving intervention and have progress monitoring have that additional practice. So you can see here some feedback, not just about the accuracy, but also the accessibility. And then coupled with the opportunity for students to have that really customized practice, we thought was such an exciting opportunity. Next slide. And so we wanted to show this because, and talk a little bit about our strategy moving forward. So you often hear from teachers about workload as a board. You often hear from teachers, and we know we've got a big road ahead of us. And I know Ms. Lichter has talked about being worried for us because we have a small team and a big lift, and we're worried too, because rolling out a curriculum K-5 is a huge lift. But we also know for our teachers, it's a huge commitment to learn something new. So we're very interested in the significant impact it has on teacher workload and time. That being said, this is very recent information that we know that we have the option. So our plan moving forward for schools for next year, schools are required to have a universal screener based on the Ready to Read Act. Because it is May, we are going to, for next year only, schools are going to have a choice to stick with DIBELS as the universal screener or to use Amira. And we're going to have them make that choice after the initial training that we've referenced that's going to happen with our literacy leaders on May 31st and June 1st, so that our literacy leaders and our principals will have a chance to see exactly what the difference is and what that would look like. And then we're going to ask them to make a choice. We're required by law to have a universal screener and to report on that data. But both DIBELS and Amira are evidence-based and approved as these screeners under the Ready to Read Act. And we believe it would be important for schools to have some agency just because of everything else teachers will be taking on in terms of professional learning and training. But because we had today and we were talking about, and of course, the impact of all of this screener is on the fidelity of that open court instruction. So that is still remains the core curriculum addressing foundational skills. So Amira doesn't replace that, but it does help us to provide that supplemental customized tutoring once we identify some areas of foundational skills that need strengthening. So I know that's been a part of our conversation as a team, as a curriculum committee. And so we thought this was a great opportunity to share this with you and to let you know our next steps. Dr. Kraft, anything I forgot, or Dr. McComas, before we open it to more questions?
No, I think you did a great job, Ms. Shea. Thank you.
Nope, I'm good.
Ms. Lichter, I think you're muted.
Sorry, I was having a little coughing thing before. Okay, so next year when we look at results, will we have to look separate? I mean, okay, so you'll have to give us those results from the schools who took DIBELS and those who chose to go with the, okay.
Correct, and we'll actually have to, we have to submit that data to the state, so we'll have to do the same at the state. We'll have to submit that report by school, which we do anyway. We have to submit it, so having to we don't submit it in the aggregate, so it will work.
That's correct.
Is the long range plan to move everybody to Amira or to give schools the choice? So the real reason is next year trying the new ELA. Okay, so okay.
It's the timing. I mean, it's May 18th. Yes. And so we're just trying to acknowledge, and you know, a lot of implementation research says that when people feel some agency around choosing, schools have invested a significant amount of time in DIBELS training and some of the materials. And so we don't want to, we believe that they'll see the benefit themselves because of that additional practice, but we think it's more powerful for them to have that agency, and it's a big lift. And so we want to honor that partnership with schools.
And then as far as implementation, do kids take it at the same time? Would they be sitting in a small group with the teacher? How would that look, especially with our little ones?
It can be, we can design any way you want it, but it's actually individually administered with headsets. So you can have a whole class taking it in the exact same 5-minute window, or you can have it be a part of a rotation. Different districts have done it differently, as the vendor partners have shared with us. The teacher doesn't need to be a part of it at all, other than just, you know, helping kindergartners get set up to start. It could be, you know, and that could be something that is done in small group just to help facilitate the logistics until kids get used to it. But actually it can be administered with all the kids at the same time, which is where we have such a significant time saving.
And then my biggest question, but Dr. Kraft already answered it, was the fact that the listening to the kids read that you get from doing DIBELS was going to be missing. But the idea that they can go back and listen to the kids, it's just, will they go back and use that feature?
It's such a great question. Oh, go ahead, Michelle. I'm sorry.
No, please, you go first.
I was just going to say it is such a great question. I think that what it allows the teacher to do is prioritize which students they listen to first versus other ones in terms of, who is coming up at risk. It also lets them spread it out over time, like during planning periods or, where it can fit in, because now it's recorded and I can go in and I can look at that. And so as you're listening to students, because obviously the only time we listen to students read isn't just, at the Dibbles administration, but also, but now I also have it saved so I can go back and listen or see, has there been progress made in the last month? Like I could actually go listen to that recording from a month ago. Whereas when you do Dibbles, you have it in the moment, but you really don't have, you would have to like really think really hard. Like, did that sound different than a month ago?
Right.
And I
also can you share it also with parents? I mean, it'd be
wonderful. I was
wonderful.
Just going to say yes. So
at conferences to be able to share the
yes,
reading and then
that's exactly
what
I was going to share. You can
powerful.
share that recording with parents to show that progress. You can share it with students so that they can hear themselves read and have that conversation. The other piece that I want to offer is if you notice at the time for analysis is the time that stays. So to me, the power is we actually spend a lot of time just on logistics and what's the error, when do you discontinue and what do you slash and what do you, and so I will offer, I think teachers will have more time for actually listening and analyzing the results than what they have in a typical Dibbles admin. A lot of time teachers are like making sure they're starting the timer or focusing on the actual worksheet and maybe not listening as much, which is why we think contributes in some cases to that lack of reliability or error because they're trying to do so many things at once. So if anything, we think this is actually going to be able to help us place an emphasis more on the listening and that customized, now what, what comes next for the student.
So I'm sorry, I'll stop it. I mean, I didn't ask any questions before, so I sound like Dr. Fern. I saved them up for now. So, then I distracted. So can the parents access the practice pieces at home, or is that just an in-school practice piece?
They can, they would have to my understanding, and so this is pretty new for us too, but what we've seen so far is the student can access it at home. So the parent would have to do it with the student. My understanding is that the parent portal gives them access to reports and suggestions, but then if they were with their child and their child was logging in, they'd be able to see those practices together. But Dr. Kraft probably knows better than I, and so she can correct me.
No. So as far as I know, that's a great question about the parent. I mean, I know they have a parent portal, but I think the student might have to log in. But I will find out exactly, and I will send you an answer to that. But I do know that the students can access it at home.
The students can access the practice.
Right. If the students can, that's what I really meant was can the practice be done at home?
And also. Some districts shared that they use it as part of the independent work rotation during the classroom. For some systems, they used it at home. Some it's a combination.
Yes.
So that was exciting to see.
There was one district that talked about during the pandemic when they were at home, they were like, thank goodness we had it because students were using it all the time.
Right. I mean, I know we didn't have any snow days this year, but had we had snow days and needed virtual learning,
this would have been great. Yes.
So, okay, Ms. Pumphrey or Mr. Manowski, your turn. Questions?
I just have one quick question and then one quick request. My request would be, if this isn't already, this may be already your intention, but I would love to hear some teacher feedback when we get the reports regarding how everything is proceeding in the upcoming year, if possible. And my question is just when the recordings of the students is how long is that information kept, and how is it? I mean, is it there forever? I'm sure it's safely stored, but I'm just curious as to how that works as the year proceeds.
So, go ahead, Michelle. I'm so.
Well, I was just going to say, I'm going to start with the second part of, we did have to sign a student data privacy agreement with this company to roster any student information. So that part in terms of security, in terms of how long an individual student, I know it's at least for the year because that student is rostered to the classroom. So the teacher has the record of the fall, winter, and spring benchmark administration. We'd have to ask about archiving after a second year rollover because we hadn't asked that yet. It's a great question. unless Dr. Kraft has a different answer. I've only ever seen about the year part.
Yeah, and my intention for that question is just along the lines of security for you know, especially when I'm sure we're gonna get that question, especially as far as AI is concerned. We want to make sure that is secure, especially if it's kept for longer than the school year.
We had to do a data privacy agreement. So Baltimore County has very strict guidelines on how it can be stored, where it can be stored, how long it can be stored. And so all of those agreements would have to be signed before we would store any student recordings.
So we can get the specifics about the timing. I don't believe it goes beyond the school year, but I will double check.
Thank you.
Ms. Dominowski, do you have any questions?
No, I'm good. Thank you.
Okay. Okay. Anything else, Ms. Shea or Dr. Kraft or Dr. McComas?
Just quickly, because Ms. Pumphrey mentioned it, that, you know, I know Dr. McComas has already started talking about our year-long plan around updates and providing updates around how the implementation is going. But that we are also partnering with our communications office to think about a year-long sort of communications plan for how we're sharing this significant investment and shift with the larger community. So both internal communication and certainly to the board and our stakeholders, but then also to our students' families and as an entire community. So I just wanted to add that because I think it is an important part, but also, you know, so that we can make sure you know that that's a part of our planning to do that as well.
Thank you. And also, thank you for everything with the ELA curriculum. I know we sent you a whole bunch of questions at the last minute based on some feedback we'd gotten from the public. So appreciate you getting us those answers yesterday or Tuesday. I lost track of days.
That was a less brief response, but that was,
right,
that was, Dr. Kraft and I are, you know, we get excited.
Thank you for that. Okay. Somebody have a
chair.
Go ahead.
Chair, I have a question for us about not related to Amir or DIVLS. It's really about those contracts that are not really curriculum, for example, our health suite records. And do we want to continue to have them brought to contracts committee? But I don't know, Ms. Lichter, if you want to wait until, you know, like if this is the moment that we want to discuss that, since we're a little ahead of schedule or not.
So and I meant to say that in the beginning for Ms. Pumphrey and Ms. Dominowski, that the reason that the health suite contracts are coming to curriculum committee is because they fall under Dr. McComas's departments or offices. So that's the real reason they're presented here, because if not, they'd kind of be, I guess, lost in where would they be presented. So Ms. Pumphrey or Ms. Dominowski, do you have any feedback about whether you feel that the health pieces should be here or whether we should be placing them somewhere else?
I don't really know if I have an opinion on that.
Okay. I mean, I think with the way we're doing it, Dr. McComas, I mean, getting us the stuff ahead of time.
I don't really have an opinion. I mean,
I mean, I think if we do it this way, where we get the information ahead and it's a very brief, you know, presentation, I think that's fine. I guess unless it's something really controversial, but I don't know what other committee would listen to it then.
Right. I think that if I may offer, the benefit for everyone is it gives at least not just, you know, all of you as members of the board, but at least gives the community and other members of the board a place where there's an opportunity to sort of hear and unpack what these different contract items are for, which I think is just beneficial for everyone in the long run. But I just wanted to, you know, make sure that we had the opportunity to discuss that just because there'll be some funny ones that you will see at some point come through that are in partnership with facilities. So when facilities, for example, brings forward the contract to buy plumbing supplies, Ms. Shea will also be presenting it here because we use that contract to buy materials for our CTE programs. So you'll see some ones that will come through over the years that at first you'll say, that's not curriculum. Why are you discussing it? I just wanted to make sure that that's the way we want to operate or continue to operate. So thank you.
Okay, sounds good. And I guess we can just make that caveat when we present it in the future, because I wouldn't have understood the plumbing stuff either until you just made the connection to the
right.
to the CTE piece. Okay. Is there any, okay, well, that was some further business. Any other further business anybody wants to bring up at this time? Okay. Since there's no, whoops, the last item on the agenda is announcements. Our next curriculum committee meeting will be held on June 22nd, 2023. Is there any other further business? Okay, hearing none, y'all get 15 minutes back to your day, and the meeting is now adjourned, and thanks everybody for being here.
Thank you.
Thank you.